A little rusty here. Good evening, everybody, and welcome to another edition of my weekly presentation, Legalese, where we discuss topics that concern the law with personal injury and medical treatment and so forth, and a lot of the issues that people like my clients and people that have questions kind of are confronted with. We have as our special guest this evening, Joe Delgidis. Joe is a board-certified acupuncturist, an herbologist of Chinese and Western herbology. He's practiced with Hudson Healing Arts in Hoboken, New Jersey since July of 1999. Joe is a graduate of Rutgers College, the Somerset School of Massage Therapy, the Pacific College of Oriental Medicine, and the American Naturopathic Medical Institute. He's currently a faculty member at the Eastern School of Acupuncture and Traditional Medicine in Bloomfield, New Jersey, and a past lecturer of comprehensive review and teaching assistant in orthopedic neurology at Pacific College of Oriental Medicine in New York City. Joe, welcome to the show.
Thank you, Chris. Great to be with you.
It's great to have you here. Thank you for taking the time to be with us and talk with us a little bit this morning. So, Joe, you're considered a naturopath. What is a naturopath, and how does it differ from a physician who'd be an allopath?
Great question. So a naturopathic doctor goes through the same kind of training as an allopathic doctor. You know, it's an ND versus an MD, but the methods of treatment are different. Instead of using pharmacological medicines, we use botanical medicines, medicinal herbs, nutritional therapies, physiotherapy, hydrotherapies, lifestyle education and adjustment, and I personally lean very strongly towards the nutrition and the dietary therapies. I start everything in the kitchen.
Good. Well, you know, you're Italian, and so am I, and that's pretty much where we start everything.
Where we start everything in life. That's right.
So, I mean, yeah, I remember speaking to you, and you put something very, 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 very apropos. You said that our bodies are a pharmacy.
Yes.
Oh, no. What do you mean by that?
Well, so inherent in the human form, in the human life force, we have the ability to enable and enact corrective mechanisms for all manner of things that come our way. Our immune systems are functioning 24/7. The heart is beating 24/7. We have neurological adjustments that occur in order to adjust for what's happening in our environment. We're all familiar with the fight or flight response. That's the nervous system telling the body we're under a great threat. We have to act very quickly to neutralize this threat and save our life. But then we're supposed to go back to normal, almost cruise control mode. What can happen over time is that the trials and tribulations of life can cause these natural corrective mechanisms. Our built-in homeostatic pharmacy can go awry. And that's where the natural therapies, the traditional healing practices like herbal medicine, like physiotherapy, sunlight therapy, nutritional and dietary therapies, acupuncture, they come in to really, really save the day in many ways. And they help to get things back on track so that the body can go back to its normal way of being able to adjust and meet all of the challenges that it faces.
Now, there are certain things that occur that can put the body in a state where, I guess, in a state of unease or dis-ease.
Absolutely, crisis states occur all the time.
And you know, the ones that I deal with most commonly are those that are the result of physical trauma that people suffer when they're typically in motor vehicle accidents or they've maybe slipped and fallen, or having a piece of merchandise fall on them in a department store. And they seem to kind of put people in a very acute state of pain and unease.
Yes.
And isn't it true that the goal should be to put the body in a state where it can heal itself?
Yes. Yes. One of the things I emphasize with my patients and with my students is that our goal is to build strategies into the body, or restore those strategies to the body, so that that person's regular day-to-day life energy knows how to respond to handle these challenges. But there are times when a crisis can get so intense that it takes a lot of work. In my case, it would be using acupuncture and physiotherapy and nutrition and herbal medicine to get things back on track and to restore that self-corrective wiring, so to speak, mechanism back into the body.
Now, if a person is involved in a traumatic accident, your advice is for them to seek emergency medical care
Immediately.
I was going to say, so there's no, some people get the wrong idea. They think that a naturopath is saying, oh, I can do all of this. No, but if a person is actually injured, in an acute injury is sustained, then they probably should get checked out. And that sort of thing is complementary to what you do, rather, and it's not considered a replacement.
Complementary is the perfect word. I'm remembering back a conversation I had with a classmate of mine in acupuncture school. This fellow was also an MD and a surgeon for about 25 years before he had gone to study acupuncture. And we were talking about naturopathic medicine being the largest umbrella. So it puts together the elements of all of the other healing disciplines, and it embraces and utilizes all of them. So we have technology. We utilize it. If someone needs an X-ray, if someone needs an MRI or a CAT scan, heaven forbid, someone needs stitches or they have a terrible wound, we get that taken care of immediately. And at the same time, we start preparing and incorporating the natural treatments to help that process.
Joe, your practice is a unique practice. How do you model your practice?
Thank you for that. I model myself after the old country doctors and 19th century eclectic physicians who grew to be called naturopathic physicians, the old farm doctors. And they would come to your house, and I've said this many times before, but they come to your house and they'll help a mother who's giving birth to a baby, but maybe there's a sick child, but maybe there's an injured father who has to take a crop in from the field or put a roof on a barn. Those doctors who cared about the entire life energy, not only of that person, but of that family, and what makes them thrive, and what is key to their day-to-day life existence. A great professor of mine taught us the first day, we don't treat symptoms, we don't treat diseases, we don't treat body parts, we treat human beings. We treat the entirety of that person and the entirety of that person's environment. In the old days, it was very common for a doctor to come to a house out in a village or somewhere in the farm country and sleep at that house for 3 or 4 or 5 days before they would take on a patient, so that the doctor understood everything that was going on.
It's very true. I remember reading in the history books how middle-aged physicians, and actually Nostradamus, the supposed prophet, used to treat and cure and rid whole villages of plague simply by coming into town and cleaning the sheets and cleaning the linens and making sure everything was sanitary. And then he also, I believe, treated them with rosehip lozenges, which were sort of like a middle-aged vitamin C treatment.
Absolutely. Yeah.
And according to history, he had a tremendous amount of success. So now that's going a ways back, but the idea is that you are taking the condition as a whole. So I imagine if a patient comes to see you with whatever the problem is, they don't sit in a waiting room for 2 hours waiting for you to see them.
No.
And you don't rush them in and out of the office. You take the time to get to know them, and that can be a pretty lengthy process sometimes, can't it?
At least an hour for every patient, and that's a follow-up. An initial visit is usually about 90 minutes, sometimes up to 2 or 2.5 hours.
Wow, that's fantastic, and that's quite a bit of time. And I take a personal approach to doing what I do in the law, and really trying to get to know my clients and who they are and being available to them. And I think that's very, very important. I think in law and in medicine these days, everyone's just making pizza. They just want to put it in the oven and they want to move it along, and they want it to take in and out 5 minutes. And it's not really good, but unfortunately, we become so used to it. One of the most fascinating areas that you practice in, and one that is probably the one of the more critical but less known, is acupuncture.
Mm-hmm.
And now you are a board certified acupuncturist.
Correct.
What does that mean exactly?
So, upon graduation from Chinese Medical College, which is a full-time 4-year graduate program of study with internship, with fellowship, with all of the things that you go through to gain that level of knowledge. You then go through state licensing exams, and you go through national board certification. And that's those are things that need to be maintained with an immaculate clinical practice and with continuing education on a regular basis. I go through at least probably about 40 hours of continuing education every year. That's just to maintain my license and board certification. I tend to go a little above what's required, and that doesn't count continuing education that I do to enhance my level of knowledge and my credentials for my practice.
Much like the law, we have our requirement for CLE, and then we have the things that we take on and the seminars we go to improve our wares and skills and so forth. So acupuncture is obviously specific enough and important enough that states make you take an exam and they regulate it as they do the medical profession.
Acupuncture is practiced now in all 50 states. It is licensed. My last check was it's licensed in either 48 or 49 states. So in that last state, it's practiced sort of on a consultation basis. But there is full out licensure in 49 states. And that requires all of the things we just talked about, plus malpractice insurance. And as I had started to say, a really immaculate practice record. If there are any problems in someone's practice, every time you renew a license, you have to submit a full explanation of what has gone on, and the same thing when you renew your malpractice insurance. So all of those things, you have to maintain a spotless clinical and practice record to be able to continue to keep your business open.
So no quacks.
No, not at all.
I've seen one or two in the medical profession, but they can't exist in the acupuncture world. Well, right. Tell us, how does acupuncture work exactly?
So, from the perspective of Chinese medical theory, we learned that the human life force is controlled and operated by literally a living energy system. Now, this energy we call qi. In Japan, they call it ki. In yoga, they call it prana. This is the living force. And martial artists will be familiar with these terms as well from their practice in martial arts. So this chi moves through a series of energy pathways on the body. You may be able to see the picture behind me right here. And there we have all of the pathways and the acupuncture points. There are over 1,000 on the body. Each energy pathway has a series of responsibilities and jobs and functions that it's in charge of. Subsequently, each pathway, we call these pathways meridians. They have a group of individualized energy points. These are the acupuncture points. In turn, they have their responsibilities and jobs. When we have a specific goal for that body, a person has an injury, someone has indigestion or allergies or insomnia or some other condition, we combine the right acupuncture points from the right pathways, and they work together like a task force, like a baseball team, in order to get that job done.
Now, does acupuncture redirect energy, or does it have a neurological effect, or is it a little of both?
It can exert an influence on the nervous system, but it does so via the redirection, strengthening, and modulation of that living energy that moves through the body. So we can affect the neurological system, the digestive system, the cardiovascular system, the endocrine system, the digestive system, the integumentary system, the skin, the hair, the nails, the immune system, etc.
Now, does it stimulate blood flow in the body? Does it help trigger some of the body's natural, I guess, for lack of a better term, painkillers?
Yes, it can help to trigger the natural pain relieving chemicals in our body, the endorphins, and it can help sharpen and activate the endorphin receptors so that that endorphin chemistry gets into the receptor so that it can work in that particular area of the body more effectively. And to answer your other question, yes, it can activate and adjust blood flow through the body as well.
And provide additional oxygen, I guess, which is key.
Indeed. Oxygen, red blood cells, and nutrients all gets delivered through the perfusion via the capillaries.
And in a situation where, say, a person's been injured, which is like what I see most of the time, people have their emergency room visits, they have their imaging therapy, but primarily their treatment is follow-up treatment with a therapist, physical therapy, acupuncture, chiropractic. Yep. And for the most part, most of the treatment people receive by far is not involving medicine or chemicals.
That's correct.
I mean, when you consider that, as far as the goals and philosophy of acupuncture and its origins, can you talk a little bit about that?
Sure. Acupuncture has its origins in ancient China, and actually stretches back close to 7,000 years.
Wow.
Yeah. And the original doctors in China were the priests. And while they tended to the people of the villages and the people in the culture in terms of their moral and spirit needs, this was a harsh world with a very tumultuous environment, and different villages and different groups and warlords in different places. So there was a lot that happened, but they also began to learn about physical culture. They learned about what's happening at different parts of the body and how different stimuli can influence that part of the body, whether it would be using pressure or using certain foods or using broths, and also using certain therapies where someone might be outside in the sun doing deep breathing and stretching their arms over their heads and doing what ultimately turned into Qigong therapy. So they were meticulous record keepers in China, and they have always been. So they would begin to take note of, such and such a farmer had this problem. Pressure was exerted here, and it affected his digestion. Or pressure was exerted on his leg, and it helped an injured or sprained shoulder. And gradually they made a map of the acupuncture meridians and the acupuncture points. The original acupuncture needles were made of stone, a type of stone called bian, B-I-A-N. And it's similar to like, we would see like flint or slate. And they would use these stones to put pressure on different parts of the body to activate them. Then, as time went by, the stones were able to be cut thinner and smaller, and they actually began to pierce the body. Then, of course, the Chinese developed metallurgy, and they went to the Bronze Age and the Iron Age, and ultimately they went to gold and silver, and now we use surgical steel for acupuncture.
And that's pretty amazing history. You said it's 7,000 years old.
Yep. Yep.
So that,
goes back 7,000 years.
By far predates modern medicine quite
Yes.
a few millennia. And acupuncture has a pretty wide application. I mean, the types of injuries people see in motor vehicle accidents involve neck pain a good deal of the time because of that whiplash mechanism.
Of course.
Low back pain it could be caused as well, usually aggravation of low back pain. Pains in knees, headaches, and migraines. Can acupuncture help for those types of things?
Yes. We use acupuncture for the symptomatic manifestations of those injuries all the time. All the time. And unfortunately, many times the source of the injury is a motor vehicle accident. Other times it could be everyday wear and tear, or an athletic injury. I've worked with many athletes over the years. I've worked with many craftsmen, stonemasons and iron workers, and some people maybe fall off a scaffolding, or there's all kinds of ways people get injured. But acupuncture can be used to help address the way those injuries manifest and to help restore a more pain-free way of life and greater range of motion and flexibility.
Are there any people for whom acupuncture is counterindicated?
So there are rare occasions when we will either not use acupuncture, maybe just use acupressure, or maybe just use very few acupuncture points with very thin needles, using very shallow insertion. Or other times you have individuals that have certain medical conditions and we can use acupuncture, but we avoid certain points. For instance, if someone has hemophilia or a platelet or bleeding disorder, we would avoid the acupuncture points that run close to the blood vessels. We can use many other points that are nowhere near capillary beds or veins or arteries, and that person will really thrive. In other times, say in cases of pregnancy, there are a few acupuncture points that are not really the best for pregnancy, so we avoid those altogether. Or if there's a pregnant patient who maybe is at a great risk of miscarrying, or tragically maybe has a history of miscarriage, then we might hold off on acupuncture and just do certain nutritional therapies and breathing therapies and physiotherapies. Everything is tailor-made for the needs of that particular person.
So suppose you are designing a regimen of therapy for somebody who suffered a rear-end collision. They've got whiplash injury, and you're performing acupuncture therapy on them. Mm-hmm. How long is the effect of acupuncture usually expected to last in a garden variety type of situation? Obviously, everyone's different, but what is there any particular length of time that one would expect the acupuncture effect to continue on for?
Everyone is a little bit different, but what we almost inevitably find is that with each treatment, the benefits last longer and longer. So they accumulate. Each treatment, it makes the benefits grow exponentially, not arithmetic. Some people start to feel better immediately. Some people, it takes several treatments to get that process, get that ball rolling. I usually know by 1 or 2 sessions which category every patient falls into. Some people feel a little bit sore that night. Like I fall into that category. You maybe have an injury from an accident, you get an acupuncture treatment, and that night you feel like, oh, I just played, football, or I just had a workout. But then the next day you feel fabulous, or you feel markedly better. So everyone is a little bit different, but all qualified acupuncturists can help navigate that process and educate their patients and reassure them as they go through the sessions and the treatments.
Now, we seem to be in an age where pain management is very, very popular. And one of the more popular methods of delivering pain management has to do with steroid therapy and steroid injections and so forth, cortisone injections. What is the downside to that? I mean, it's not surgery, so it's not quite as invasive and quite as life-changing a proposition as a surgery might be, which the effect of surgery may be 38% positive. They seem to be a little more successful with the steroid injections, but what are the downsides for a person that's undergoing that type of therapy?
Well, normally there's a limit to how often a person can receive that kind of treatment. For instance, usually it's capped at 3 epidurals or 3 facet joint steroidal injections. If a person is taking steroids internally, they'll monitor the level and the milligrams of the steroid very carefully, because there can be other effects on the kidneys, on the endocrine system, on the blood sugar, etc. And they have to make sure that things are very meticulously monitored and watched.
In fact, steroids also have a dampening effect on the immune system in certain cases.
They do have a dampening effect on the immune system, and over time, they can weaken the connective tissue in the area where an injection takes place. We've all heard the stories about, the old football players that would get steroid injections in their knees after an injury, and that could be good for a one-time fix, or twice every, long distance apart, so that they can activate with physiotherapies and do other modalities there. But over time, the connective tissues, the tendons, the cartilage, the ligaments, and the muscles can weaken and sometimes even tear.
What about the bones?
There can be a negative effect that doesn't necessarily happen with everyone, but there can be a negative effect on the skeletal system as well. Yes.
Now, acupuncture therapy really has none of these downsides to it, does it?
No. It has side benefits, but not side effects. Properly practiced acupuncture, and it might be something for physical pain, we can simultaneously, with that very same treatment, someone may notice, hey, I'm sleeping better, or my digestion is better, or I was around a bunch of sick family members and I didn't get a cold. That can happen all the time. Now, occasionally, there can be a little bruising, or there can be a little discomfort or a sensation around an acupuncture point. That's where we always communicate. As physicians, we communicate with our patients. As patients, we communicate and provide feedback for the practitioner, so that everyone knows what's going on and anything can be addressed right away.
Do you feel that a patient's state of mind is relevant when they're having acupuncture therapy? Is it something where, they really benefit from believing in the process?
To the degree that it makes them willing to come in for treatment and stay for the entire session. It's been pretty solidly proven that there is no real placebo effect with acupuncture, because researchers have used what's called sham acupuncture, or acupuncture on places of the body where there is really not an acupuncture point. It's just a barren zone, and the benefits did not take place. Also, acupuncture has been done by veterinary acupuncturists for pets, for whom there is no placebo effect. And they have, in fact, gotten physically better from injuries and from internal conditions as well.
Wow. Okay. Can children benefit from acupuncture therapy?
Of course. The youngest patient I've ever had was about 3 months old.
Wow.
The oldest patient I ever had was 103 years old. So across the board, across all age ranges, acupuncture can be very beneficial. And the very, very young and the very old tend to respond the quickest.
Well, Joe, that is some fantastic information, and thank you very much for appearing on our show this week and teaching us.
Chris, it's great to be with you. Thank you for your time, and thank you for letting me participate.
Now, unfortunately, I have limited time, and there's so much more to know, but I certainly appreciate you taking the time, and just want to urge the people that are watching to understand that, acupuncture therapy is a great alternative therapy. It apparently has no real downsides to it, like certain pain management therapy modalities do. And when it's being delivered by an experienced and board certified practitioner like Joe Delgides, unfortunately, he can't really do it for my Florida clients, but people that I know up in the tri-state area would definitely benefit very highly from getting a hold of Joe at Hudson Healing Arts, where he practices in Hoboken, New Jersey. Well, folks, thank you very much. And if you like the information that you heard today, please feel free to share this and hit that like button and comment below. I often fashion entire segments out of people's questions. And this was a question that somebody had asked me. I have one client in particular asked me about acupuncture therapy, and I thought I know somebody that knows more about it probably than anybody. So I wanted to have him on the show, and Joe was great. He was nice enough to appear on the show, and we're really happy to have him. Folks, thank you again, and have a great week, and everybody be safe out there and be careful on the roads. Thank you.